Right, 6:30. Good evening, everyone. Thank you for joining us. We've got University of South Wales again here this week. Don't know how many of you joined us last week for an introduction to the allied health courses, but this week we've got Ollie back and Pamela back telling us how to apply to healthcare courses. They're going to take you through all of that in a minute. As previously we've said, if you've got any questions, please ask them in the chat box, and we'll try and answer them in the chat as we go along. But if not, we've got a dedicated amount of time for questions at the end. We look forward to, we hope you find what you're going to hear useful and you're able to use it in the future. And I'm going to hand over to Ollie now to get us started.
Thank you, Mitesh. My name's Oliver Stacey, and we're going to be looking a bit at applying to healthcare courses. I'm mainly going to focus on, in my section, more what you should maybe be doing in the run up to September in building up your evidence portfolio for applying. And then Pamela's going to focus much more on nursing specific applications. And I'll probably chime in because I quite like the sound of my own voice, but also because I can sort of give some ideas of how other subjects interview that I've seen on our panels and how you can transfer stuff across. If you've got questions, put them in as we go through. I think what was brilliant about last week was we had lots of different questions. And I think for you to gain the most out of the session, the best thing to do is, if something comes to mind, is please do ask us. So mainly with your application, the starting point is going to be that you're going to have to write a personal statement. This is the only bit of your application that you have total control over. You do have some input on what grades you get by how hard you work, but ultimately, if the wrong exam questions came up, things might not quite go to plan in a sort of exam scenario, or potentially with a BTEC question. So this bit really is about showing that you're interested in the course as much as possible, and that you're passionate about that particular field and what you could offer in the future. It's 47 lines long, or 4,000 characters, which is about a page and a quarter. I'd say to people, if your statement's under a page, that it's probably not ready to send, and that probably at that point you should seek some further input from maybe a careers advisor or head of sixth, or potentially your teacher or someone maybe through the university as well, or coming to an open day. And you get one statement for all choices, which Pamela will touch on quite a lot with around nursing, and how you can sort of make sure that you really specialise your application. And the other thing to just comment on is when you put your application, it will be on your UCAS profile, which some of you may have already created. There's no spelling or grammar check on there. So do make sure that you probably put your personal statement in something like Word, first of all, and then you can shift it across once it's ready to send. So before you start the personal statement, these are some of the things that we suggest that you do as some of the steps. I'm just going to touch on these a little bit. So research the subject. We talked a lot about our subjects last week and gave a bit more of an insight of maybe how they differ and some of the different requirements. You need to sort of get an idea of what skills you've already got, and then maybe start to match those up with the course. And if there's gaps, then this is the kind of time to start to develop some time in those skills, certainly through the summer. Keep a bit of a record of your progress so you get some accurate, very insightful things that you do, and then have a look at the university as well. So the main thing to focus on is no two courses are the same, and we're going to focus quite a lot on nursing this evening, and they differ in terms of the different branches of nursing, but obviously look at things like the entry requirements and some of the assessment things. It could be what facilities are there, all of those sorts of things, and how they enrich your course experience are really, really important. In terms of mind mapping your skills, I would suggest the starting point is a really good thing to consider, certainly doing probably in March, could be even in year 11 that you start to do this. So you maybe put down what subjects you do at the moment, maybe what subjects you're interested in studying in the future, and some of the skills that you've gained through those. You might have done some different voluntary or work experience. I've got, for example, barista work in a cafe. You might have done some care work. You might have been a babysitter. And then start to think, well, what skills did you gain through those? What soft skills did you gain? You know, you're showing sort of compassion maybe for a young person in terms of managing bedtime or whatever is involved in the babysitter type role. You might have done some extracurricular stuff. So you might have done school performances, been a tutor rep, showed sort of your integrity in something there, or commitment to something like martial arts, and career aspirations. So I've tried to put some medical ones here. I'm not sure, Pamela, you might have some insight of whether these are a little bit more work, but things like maybe a leadership role in the future within a ward, training others, or potentially a particular area that you want to specialise in as well. So those sorts of things at the end of your statement, it's really good to give an idea of what the course would enable you to do should you see it through. And then the other thing to consider would just be trying to keep a bit of a record of what you do each month. And I would try and be more specific than I've studied level 3 health and social care. I would try and go into, well, what were some of the topics and assignments you did? What visits have you been on? What things have you read, or maybe podcasts you've engaged with, and maybe what challenges you face. So to give you a little bit of an idea of what this might look like, in terms of topics and assignments, you might have done the case of baby P, for example, and this maybe looked at different aspects of the care system. You might have attended an open day during that month as well, and you might have looked at the clinical simulation centre, and that's gone on to increase your desire to go to university, or you might want to look at a course that has some similar facilities, for example. You might have been on the NMC website, and you might have looked at the responsibility of professionals and their sort of accountability when things go wrong, and that might be something that's sort of linked into your topic as well. But by doing this regularly, you'll kind of get more specific examples, and that will strengthen your statement. And these are some of the things that you can write about. So your personal statement should be personal to you. If me and Pamela wrote personal statements about ourselves, they would be massively different due to all of our schooling experiences, different things that we've done in life. You might have been in the same class as some of the people you're applying with, but you will have done little things that are different. It's unlikely that every aspect of your life is entirely the same. You might have done things like Duke of Edinburgh, you might have done different work roles, and as we mentioned, sort of other things within the family as well. And then this is something we'll touch upon as well. I think sometimes we feel that you need relevant experience. In some courses you do, and we can touch upon some of those, but actually you will gain lots of transferable skills through the things you have done. And sometimes it's about thinking how you can apply what you have done and put it in a slightly different setting. For example, it might be that you worked in McDonald's, is something we talk about sometimes with sort of nursing presentations, and some of the skills you gain through that and how that would relate to maybe a busy environment there. And then the other things to think about is what skills you've got more broadly. So these often are skills that are considered very important to employability across a range of courses, and also from employers. You're not going to have time to write about every single skill within this board, but you might be able to pick out 3 or 4 that are the most important. And I would also say that we recommend going on the 6 C's of care if you're looking at health courses as being a nice basis of some of the skills you might have gained. So you should really pick out some and give some detailed examples of how you've developed these skills, what some of your life experiences have enabled you to do to link to your degree. And then the other thing I'm just going to touch upon is maybe why you want to study the course. So lots of people sort of say, well, how do I start a statement? How do I show that I'm really passionate about this subject? Now, I don't really want to tell you exactly how to start your personal statement, because it obviously is a personal document, but I would say these are the 3 areas that we get that are quite common for most people. So the first one is you've got some sort of personal experience as your inspiration. So it might be that you had a teacher at school. It might be that your grandparent is the person in this picture who's received this wonderful care, and that's inspired you to go on into that career. So those sorts of personal interactions. Might be that you've got a family member that does that job, or a family friend. That's absolutely fine. Skill sets that you enjoy, so that's absolutely fine as well. And then the third one is sometimes topical issues. It might be things that certainly there has been an renewed interest in the health professions through the pandemic, and seeing some of the amazing work that people do. And it's cast maybe more of a media light on that, which was work that was already going on, but maybe wasn't given as much of the spotlight as it has been. And that could apply in lots of different careers as well. So that can be another way that might have show where your interest came from for that particular topic. Now I'm going to sort of move over more to nursing and midwifery stuff now, and then we'll pick up some more general questions about broader applications. But I hope that gives you a bit of a start. Right, over to you, Pamela.
Hi everyone, my name is Pamela Davis. I'm one of the senior lecturers here at the University of South Wales, specialising in nursing. Oh, this is the part where I need to remember how to move it along. Oh, Ollie's done it for me, thank you. So there might be a little bit of repetition, but I'm just going to try and build on some of the stuff that Ollie's kind of said. So what you need to succeed in nursing and midwifery is a whole variety of skills, and these skills need to shine through in your personal statement and when you do come for interview. And things like showing that you have an interest in people, that you enjoy being around people and you have the ability to communicate with people is really helpful, because within nursing and midwifery and all of our health sciences that we offer here at the university, you need to be able to show that good communication skills and that kind and caring approach to people. And this applies not just to nursing and midwifery, but to operating department practitioner, our physiotherapy, and our occupational therapy, which is our other health sciences that we offer here. You need to have the ability to uphold the standards of the NMC for nursing and midwifery. Now, this is really important. So when you start thinking about applying for nursing and midwifery, when you start thinking about interview and personal statement, it's really key that you know what the NMC is, so that you know what the Nursing and Midwifery Council is, because this is something that we're going to want to see the values of this kind of shining through that personal statement and within your interview as well. And it could be that you actually get asked about the Nursing and Midwifery Council within your interview as well. So one big tip would be, if you are looking to study nursing and midwifery, Google what the NMC is and have a look at their code of conduct. Oh, I think Ollie's going to have to be my presenter. One thing you need is a sense of humour in nursing, in health sciences, in medicine. So I know there's a lot of things about medical sciences and medicine. One thing you need for any kind of healthcare career is a good sense of humour. Now, this is going to get you through the rough times. It's going to get you through the tough times. It's really important, because when it comes to nursing and midwifery and healthcare sciences, we're always talking about things like poo and vomit and sputum. So you need to have a good, strong stomach to be able to do any kind of health sciences. We could be sitting there eating a toffee crisp and someone will ask about what someone's poo looked like, and we will always take it back to what a chocolate bar looks like. And when somebody leaves nursing or midwifery, we generally will make them a cake that looks a little bit like poo, because we just love talking about it. So you really do have to have that kind of good sense of humour. And if you come to one of our open days, you'll see that all of the staff within the health science team are all usually very jolly and like having a good giggle about things, especially things to do with poo. And we often tell stories about poo or sputum or pus coming out of our patients, because for us, it's, you know, part and parcel of the job, and it's something that you need to be familiar with discussing. So yeah, nice. Lots of poo. I wonder if that picture made anyone hungry. So applying to USW then, so there's been some tips already about applying. So for nursing and midwifery, for ODP, for OT, for physio, all applications will be taken via UCAS. You need to make sure that your applications are in on time. Now, it's really important when it comes to your application that it's focused on your preferred field, okay? Because we want you to demonstrate why you want to come into that particular field. So if you're applying for physiotherapy, adult nursing, OT, and medical sciences, so if you're applying for all of these courses, how would your personal statement be able to reflect all four things? So at this point, before you even start thinking about personal statements, start thinking about application, you need to really focus on what it is you want to do. Do you want to do medicine? Do you want to do nursing? Do you want to be an ODP? Is physiotherapy what you really have your passion in? Think about what it is you want to do. Think about the skills that you've got and what skills is needed in that profession to make that profession something that you're able to do. sometimes we have great aspirations of becoming things like pilots or something like that, but you're scared of heights and don't like being, you know, being in the air away from people. We need to be realistic about what it is you want, what the skills you have, so that you can bring that into the profession, so that you can enjoy that profession and you can thrive within that profession, and so that you can be an asset to that profession. So really have a good think about what it is you want to do, so that in your application you can focus on that field. If you want to do children's nursing but want to hedge your bets and apply for children's nursing and adult nursing, how will you get that across in your personal statement that you want both, or that you're hedging your bets on the other? So you really have to make that personal statement really specific. So make sure you focus on that field, that profession, that speciality that you want to go into. You will be emailed if you get an interview, so you'll be emailed. At the moment, all interviews are online, but this may change after September. We take an all-Wales approach in nursing and midwifery to our interviews, and at the moment that is all online. When you are applying, one of the big things obviously is personal statement, which I'll talk about in a minute. And then the next thing is think about your email address. So all correspondence from us here at the university is going to be emailed to you. Some people might get their email address when they're much younger, because people are getting email addresses much younger these days. And it might be, I am great at Minecraft 123, or michaelbubleyforever@gmail.com. So think about your email address and make it something that's professional. All health sciences is professional and it's registered with a professional body. So make sure that your email address reflects that.
Just add on the interview section at the moment. I know ODP are interviewing in person. I've sat in on as a member of those interview panels. I believe physiotherapy are as well. And I think there's, however, I would say if it's a problem, we did have some people who wanted to do their interviews virtually. I would say they consider why you want to do them virtually. I would say undoubtedly, I know I've done some interviews today. It does cross your mind in terms of, is that person that committed if they're not necessarily willing to travel? It obviously depends on the context, but actually if it's that you haven't visited there before and it seems a long way away, do consider, well, would you actually move there if you were going to study as well? I do think that gives a starting impression to us as an interview panel of kind of how much you're willing to commit. And actually sometimes, yeah, it might be a bit more effort and it is a bit nerve-wracking, but actually that's a really good experience. And I think even just going through an interview process for a lot of people is a really positive one, and something that is a skill for life, really, because even when you finish your course, it is going to be a skill you use time and time again.
Yeah, I think that's a really valid point. I've interviewed people that have flown over from Ireland and we've had to make their interview later in the day, and it really shows that commitment to not just the university, but to what they're trying to come into. So I think that's a really good point. Okay, so personal statement then. So as Ollie said, fill the 47 lines, fill that 4,000 words that you have. Okay, that's your first opportunity to be able to get an interview. If, for example, you're applying for midwifery, we only have 45 spaces for midwifery and we have 400 applications. So make sure that personal statement is as best as you can make it. You use the 47 lines, because that is going to be the only thing that's going to secure you an interview. And once you've got an interview, you're one step in the door and you have to get through that interview then. So make sure that you do fill that personal statement up. Make sure in that personal statement that I know what you're applying for. So if someone gave me a personal statement, I could read it and say, okay, this is Ollie. Ollie is applying for mental health nursing, because it's clear from his personal statement that he's got passion within that field, he's got knowledge within that field, his qualities, his transferable skills have really shone through in his personal statement. So I can tell straight off the bat that that's what he's applying for. And I think that's really key here. Have a look at your personal statement and think to yourself, do I know what I'm applying for from just the personal statement without looking at anything else? So make sure that that really comes in your personal statement. Make sure you put loads of transferable skills in there. And I don't mean a list of transferable skills. People will often write, I encompass the 6 C's. I'm caring, I'm kind, I'm compassionate. But how are you kind? How are you compassionate? How can you demonstrate that within your personal statement? Because anyone can write a list. And I think it's a good idea to write a list. Write a list before you write your personal statement of all of your transferable skills. If you can't think of your transferable skills, get your mum, your dad, your auntie, your granny, somebody else to write a list of your skills, and take that list and put it into context within your personal statement. We're not looking for lists. I'm looking to know why you're kind, caring and compassionate. You're kind, caring and compassionate because you looked after your nan during her terminal illness, or you're kind, caring and compassionate because of the work you've done with the Girl Guides or the Rangers. You know, put it in your personal statement. We want to get to know you and your skills and your qualities in your personal statement. And it doesn't all have to be focused on that health science that you're applying for. You can talk about yourself as well, and the other transferable skills you've got from things like sports, for example, or musical instruments you've played, and why this is giving you the ability to grow other skills. So make sure that experience and your skills is within your personal statement. It's always nice in your personal statement to put a little bit about why you want to do it. So I know Ollie said that it's good to put in why you want to be a nurse, why do you want to be a midwife, why do you want to be a physiotherapist. So put that in there. If the reason you're doing it is because of something that might trigger a memory, so I already said about nan dying. So if the reason you want to come into adult nursing is because you helped nurse your nan when she was dying, I might say something about your nan, something about her dying. And if that's going to make you cry, for example, then don't put it in your personal statement. Okay, because it's really important that you're able to be composed during interview and be able to talk about it. So anything you put in your personal statement, we will ask you when you come into interview. So don't put anything in your personal statement that might trigger a memory that's going to make you upset or unable to carry on the interview. And please don't put any text language in. So I'm hoping that everyone gets a personal statement proofread, and there won't be any LOL or anything like that in your personal statement. So make sure there's no text speak. I keep trying to tap it, but I know Ollie's got control.
Yeah, you're on to interviews now, yeah.
Lovely. So once we've received your personal statement, we've read your personal statement, we've then decided to offer you an interview. So for nursing and midwifery, that will be over the computer until September, and for other health sciences, that might be face to face. So you will receive your invite for interview. Respond to that invite promptly. Okay, so respond to that invite promptly. Bring any identification required. So even though nursing and midwifery are online, you still have to show photograph ID. Okay, so 9 times out of 10, every time I do an interview, I'll say, thank you very much for coming for interview. If I can please just check your photograph ID, and they all say, oh, just give me a minute, I'll go look for it, even though they've been told that they need to have it. So just make sure you have all documentation there ready. This is a professional regulated course, nursing and midwifery. So are the other health sciences. They're also professionally regulated. You're wanting to enter a profession, so make sure you dress appropriately like you want to join a profession. I've had people turn up for interview in shorts and t-shirt. I've had people turn up in like joggers, like they're going to the gym. The online interviews have opened up a new whole host of dress appropriately conundrums. So we've interviewed people in their dressing gown, for example, in their pajamas, in bed, wearing their pajamas, with their 3 kids behind them and their 2 dogs on their knee. Make sure that you dress appropriately and you've tested where your computer is going to sit if it's online. So make sure where your computer sits, there's not a massive, you know, Beyonce poster behind you that's going to distract me throughout the whole interview. So make sure that you're not only dressed appropriately, but the area that you're doing your interview in is appropriate. A nice example of that last week, what day are we on? Last week when I did some interviews, I interviewed a girl in college. So she was sat, I hope she's not here because I'll give it away. I interviewed a girl who was in college. And I felt very sorry for this girl. So she was in a classroom with her computer. She looked very nice. Started the interview, and one of her teachers came into the classroom and told her to leave. And she was like, "Sir, I'm on the computer to the university." And he was like, "Please leave this classroom." So then the poor girl had to get up, walk through the college, find a corridor where she could then sit and do her interview. Now, I felt very sorry for the girl, but that didn't make her feel at ease, and it wasn't very nice for her. So make sure that you're in, you've got a designated time, you know where you're going to sit for your interview, and you are dressed appropriately for that interview. Read your application form, read your personal statement. The last thing I read before you walk in the door or before I take you into the room on the computer is your personal statement. So make sure that everything on your personal statement you remember, you know about, and that it's all true, because I'm going to ask you when you walk in the door. We're going to ask you questions about the course that you've applied for. We're going to ask you questions about the university you've applied for. So I know all about Swansea's nursing course because I've had several people telling me about it in interviews. So just make sure you know what university you're coming to, what university is interviewing you. Make sure you know about the field of nursing or the speciality, the midwifery or the OT or the ODP course that you're applying for, because we will ask you about it. There might not just be me on the interview panel. Ollie said earlier he was in with ODP interviews the other week. So we do sometimes use a panel of people. So we'll use service users, we'll use clinicians. There's some schools that we use. So we'll use some school pupils, we'll use other academics within the school, and we'll use our students as well, our other student nurses. So it may be a combination of people on the panel. So be prepared to answer questions from everybody. Now, the interview, what you're wanting is you're wanting to shine in your interview. You're wanting to show your potential to be an effective nurse, an effective midwife, an effective physio. We want to see that in interview. The interview is not a test. It's about us getting to know you to make sure that you are the best person for this course. So make sure you demonstrate that in interview. Lastly, show the interview panel you've got what it takes. A couple of other tips for interview then on the next slide.
I was just going to add two things on there just before you jump in. I just think it's a really good one to think about with interviews that we do offer mock interviews as part of the recruitment team. And I think Pamela's example with the student there's quite a brutal one, but I also know, having been a teacher before, that I've had students who've used things like the careers office to do their interviews. So if you know your home life's really busy, and I can certainly think of one where there's sort of kids crawling all over the sofa and things, if you know that it's a busy environment at home, do ask for help. I think that's really important in making it as pleasant an experience as it can be for you. And I also think when you meet your team that interview you, that's a really good chance to get a feel for the university. And I know certainly when I've spoken to students who've been interviewed by Pamela and Maria, they very much remember quite a lot about their personality and their character. And I think actually, if you get a bad experience, that is for one of your first insights to that university as well. So do actually think about it from the other perspective and prepare some questions to get a real feel for whether it's the right place for you. But sorry if I've stolen anything off the next slide.
That's all right. And I think one thing there that Ollie said is really good is prepare a question. So have a question ready, because at the end of the interview, we'll always say, have you got any questions? And there might be a question that you think of during the interview, but I would always have something prepared, because it makes it look like that you've taken interest in the university, you've taken interest in the course, you've taken an interest in the career path that you're going to go into, and you've got a question about that. So I would always have a couple of questions under my hat ready in case we say, have you got any questions? So just a couple of general things then. I've already said things like understand the course, why you've chosen the particular field. So I've put here adult field in particular because that's my background, but know what you're going into and why you've chosen it. Okay, so whether that's physiotherapy or ODP, make sure you know why you've chosen it and make sure you know what that career is and what that person does in their job. We always get asked things like, do we need to have experience in healthcare? And I think it's really important that we make it clear you don't need experience in healthcare. You don't need experience working. Everyone's got experience in their life that's transferable. So whether you've got healthcare experience, whether you've got a part-time job, or whether you've got volleyball or netball or violin or piano, or even if you've got none of that, everybody has got transferable skills that they can bring into this profession. And it's about talking about them, not just in your personal statement, but when you come in to interview. You can get experience, so you can get voluntary experience. Now, it's more difficult getting voluntary experience now because of COVID, but there are some places that are still offering some volunteering, things like the Student Volunteering Cardiff. But if you Google it, there is quite a few places that will still do volunteering work, and that could be over the phone or it could be over the computer, but there's still some experiences out there. You're not at a disadvantage by not having healthcare experience. So we often get asked, well, you got lots of people that work in health that apply for health courses. Am I less likely to get it? No, the simple answer is no, you're not less likely to get it if you've got healthcare experience. Sometimes people with healthcare experience come into the profession for the wrong reasons, and that becomes very obvious during interview. So an example of that could be, I had one of my first interviews I ever did. The girl was a healthcare support worker, had been working in her family's nursing home, and we said, why do you want to be a nurse? There's nothing wrong with being a healthcare support worker. We need really good healthcare support workers in this world, in the NHS, within healthcare. We need good healthcare support workers. And her reply was that she didn't want to wipe bums anymore. Well, that just gives you the wrong idea of why she's coming into this profession, because I was an intensive care nurse, and a lot of being an intensive care nurse is wiping bums. We don't have healthcare support workers to do it for us. It's not about it. So you want to make sure that you kind of take your reasoning into your interview of why you want to be a nurse, and you're not at any disadvantage if you've not had that healthcare experience.
Just add, for a couple of the courses that we do offer, there are some requirements to work in industry. So, for example, social work, we require approximately 350 hours. It'd be worth checking on the course page. And physiotherapy are asking for some experience, and that might be sort of assisting a sports therapist or something along those lines for a couple of weeks. One question I have, Pamela, which I always get stuck with on these sorts of things, is, would you advise somebody, if they are going to get work experience in the next couple of weeks, but haven't by the time they write the application, but probably will by the interview, to put it in their statement, because they should be able to mention it by the interview, and then they can talk about the skills they would gain from it?
Yeah, so they can.
No, I think we might have.
At the end of the personal statement is we look for that, where do I see myself going? So what you can write at the end of the personal statement is, you know, something about, I'm looking to join healthcare, or I'm going to be starting a volunteer job and I'm very excited about it because these are the skills I believe I'm going to gain. You know, they can put it at the bottom of the personal statement to say, this is what I'm intending to do prior to coming in the course. And then that will give us, when we read it then, before you come into your interview then, we will say, oh, I can see in your personal statement that you were hoping to start volunteering. Have you done that? And then that will give you the opportunity then to discuss all them skills, all that knowledge that you've learned from that. So yeah, definitely put it in there.
I can see Michelle's joined us as well from our social work course. I don't know, Michelle, if you did want to talk a little bit about your interview and application process, and maybe how that, anything that's slightly different with that.
Hi Ollie, hi everyone. Yes, for social work, the interview is it's now a two-stage process of a written piece of work based on our codes of practice in social work, and then an interview that's based on 7 set questions, and there's advice on those questions on the webpage to prepare people. And we do require the 360 hours experience prior to interview. I just want to make that clear. So if someone hasn't got it at the point of application, it's that they're working towards those hours prior to the interview stage. It used to be prior to application, but now it's prior to the interview stage. And again, like I said, we do require that experience. It's a requirement of Social Care Wales, who regulate the programme, that every university has to require those 360 hours. If that
Perfect.
helps.
Yes, no, that definitely does. I'm just going to talk about a couple of other things that are quite useful, and I'm hoping both of you can pop some ideas in here before we deal with a few questions. So firstly, Pamela's slide here has got the Instagram and Twitter handle for USW Nursing, Midwifery and Care Sciences. Now, obviously, I hope off the back of this that that's something that you go on to follow, but I would also say if I was a consumer who was looking at university, I would look at several different nursing pages, follow all of them because they might have things like articles, little webinars, podcasts, and start to just build up your knowledge there. And I would definitely say to students, I can see a lot of students are looking at medicine. Universities that study medicine, their medical pages will have stuff. And typically when I've done things like mock medicine interviews for schools and colleges I work with, the sort of questions you might be asked to deal with might be to relate about an article that you've recently read, for example. That's quite a common question. So those sorts of things can be really useful in kind of keeping you current even before you've started the profession, if that makes sense. I don't know if there's anything extra you'd look at in terms of for guidance on things to keep an eye on, Michelle or Pamela, as areas to go to.
I think the Instagram and the Twitter is very good idea. The Instagram is 100% led by our students, so they completely run the Instagram, and it gives you a good insight not only to USW but into nursing, adult nursing, child nursing, midwifery's there as well. So it gives you a good insight into the life of the student nurse and into the profession. So I think that's a good one. Lots of things on Twitter. Twitter is very helpful. And has lots of really good resources. So I would look at nursing or whatever the health sciences you're going to go into. There's always lots of current guidelines on it. So things like the NMC, which is our professional body, they will post things on Twitter. So that's very helpful. So I think these are the two kind of good platforms to kind of look at.
So just going to start to pick up a few of the questions that we've got in the chat. I can see there's a few around entry requirements for medicine. We don't do medicine, so we can't really comment on that very much. The things I can comment on with it, every course page that you go onto with each university will have their entry requirements, and I guess with whatever healthcare profession you look at, it's really worth you look at all of those requirements. Exactly as Michelle said about number of hours, that might be different in Welsh institutions compared to English. In terms of exactly what subjects they look for might vary from university to university as well. So those sorts of things are really essential for whatever you look at. The other question I've seen that's come in is about abbreviations like don't or it's matter. Nowadays, I think it isn't as important as it maybe was 5 years ago. However, I would say it's something to consider. It's just you need to be consistent throughout. So if you use them earlier in the document, I would keep them throughout. Personally, I prefer full English, but that might be me being a little bit old-fashioned in that sense. I don't think in terms of what we look at, Pamela, we don't really tend to throw people out with don'ts and it's at this stage. I think it's probably a little bit nitpicking if we're doing that sort of thing. So if we open it up a bit more to questions, I don't know if we've got any more of people who've started personal statements, maybe skills that you've got, or maybe you've got interviews coming up. Then we'd be happy to take some details on those kind of questions.
So Ollie, just while we wait for anyone to pop any questions into the chat, someone asked whether you're going to have access to the presentation after the session. This session's been recorded, so you should be able to see the slides on a recording once we send it out, and we'll send it out to everyone in the next few days. Ollie, there's something about intercalated degrees. Is that, I actually don't even know what that is. So is that something you guys
we do with some subjects. We don't really do them within the medical areas. So you could do, we do things like business management or business marketing, things like sports journalism. I mean, it's slightly different areas, but we don't really do a specific health one that's combining two areas in that fashion. I'll be honest, I haven't seen many, so I'd be very curious within the health professions. I think because of the accrediting bodies, I think it's quite hard to do one specifically within medicine. You could look at something like biological and pharmaceutical sciences, which I guess would have some links to the medical professions, but that would be a bit more of a, more of a tangent than a clear link in that sense. Good question, this one. Personally, I think I'm going to stick away from this one. What's appropriate dress code for an interview for a female?
I think whatever you're comfortable in to start off with. So you have to be comfortable in whatever you wear. So that's anybody really, male or female, it doesn't matter. You have to be comfortable in whatever you're wearing. So whatever you wear to an interview, it should be comfortable. You want to look professional. So when I say comfortable, I don't mean joggers and a t-shirt. So I mean something smart. What would you expect a professional person? So what would you expect a doctor, a lawyer, somebody professional, nurses, what would you expect them to look like when you come for interview? I don't want to see your bra. I don't want to see your pants. I've seen people's pants in interviews before. I've seen lots of bras in interviews before. Make sure that when you sit down, especially if it's face to face, make sure when you sit down, your skirt's not that little that we're going to see your pants. Make sure your top's not see-through. Make sure your top's not, down at your belly button. I think you need to be sensible. So I would wear something comfortable. Make sure it's decent, and just make sure that it's clean and that it's not casual wear. So just a shirt, a pair of trousers, a shirt, a skirt, anything like that's absolutely fine. Just make sure that your shirt's not see-through and that your skirt's not too short.
Can I just add, don't dress like you've just come from the yoga studio either. I've seen that happen as well.
Yeah.
I would say see-through shirts are probably a no-go, regardless of genders, to be fair, on interviews.
Yeah.
I also think, just on that front, one thing I've noticed with the online world is camera angles with interviews. I never really go for that angle because it doesn't suit me very well at all. But I just think, have a little think about that in terms of, I would always say a computer will set something up that's in kind of a fixed place, rather than possibly sort of Instagram angles that people might go for. Another question we've got: if you were to do work experience in dentistry, would it be able to apply that experience to a healthcare medicine related degree, since it's clinical based and involves patient interaction? I would say absolutely. And in the same way, I think you could adapt what age you'd worked and adapt it to a different audience. I think that's very much the skill set we're talking about. Would you agree?
Yeah, absolutely. I mean, there's so many skills that you would get that's transferable, that you would get in any kind of, health environment, whether that be dentistry or whether that be hospital based. But loads of skills around communication skills, that kind of caring skills, being able to even hold, like if anyone's been to the dentist with someone that's a little bit nervous, holding someone, de-escalating them, holding their hand, showing that comfort, and then the technical skills you've got as well. So to be able to learn that technical skills and build up your knowledge. So really good experience that you can transfer into any kind of health science.
Good. And I'd say a really good one that we get quite a lot is something about when people want to be physiotherapists who maybe shadow like sports therapists within maybe a local football or rugby team. I would say possibly the environment of those places are slightly easier to get into and get some observational skills than maybe some of that clinical practice. So that can be a good way to work around that. There's loads of questions coming in. So jobs you can do if you do medical sciences. Well, medical sciences predominantly is a widening access course to medicine at the university. So you get 4 applications to medicine, and you have to have a 5th choice, which is not medicine. So medical science is a 3B entry. At the end of your course, you get an interview at either Cardiff or Swansea, depending on your choice. And the idea is you go into the 2nd year of a medicine course. So it is an accelerated option in terms of moving you into the further up the medicine course, but still a full degree. You develop a lot of different lab skills, but the majority of students, because they do a lot of placement focus, a lot of healthcare focus, it's very much skilling you up to be a doctor if you don't quite get the grades to be a doctor. So I'd really recommend checking it out. There's a cracking YouTube video by the course leader, Lewis Fall, which really breaks down the full course. And actually YouTube is another resource you can get some good info on courses. Right. Next one. About this one, I think would be good to get your perspective from both courses. Actually, people with additional needs be provided support with interviews if their communication need. I assume if you're to communicate their needs, yeah.
Yeah, so if you need additional support with interview, generally we will ask you prior to coming into interview, but we also ask you at the start of interview if you have any additional needs that we can cater for during your interview. The more comfortable we can make you feel and the more enabled that environment is, the better you're going to perform. So anything that we can do to help during that interview, then we will do.
And the same for you, Michelle, I assume?
Yeah, same for us. If anyone needs extra support, then yeah, it's about being comfortable and comfortable in preparation for the interview. Yeah, that's no problem at all.
Just communicate that as much as possible, I would say. So next question, would placement at a day centre benefit me in an application to nursing?
Yeah, absolutely. And it's the same kind of answer as the last one. Loads of transferable skills from that day centre. So just think about everything you do within that day centre, everything you see within that day centre, and how they can transfer into nursing. But loads of really good things around communication. I can't stress communication enough, because to be able to be an effective nurse, you need to be able to communicate with people. So anything that can, show off your communication skills and enhance your communication skills is really good. So yes, that would definitely benefit you.
We've got things about virtual experiences. Yeah, they're absolutely things that you can include in CVs and applications. I've heard of people doing virtual work experiences, and we've run some of those through the pandemic. I think some of those things will be here to stay. I think they're certainly things like online MOOCs are really good opportunities with lots of courses to kind of further your knowledge. So definitely put them in there. I'd maybe just be a little bit cautious of name dropping exactly what university runs them, because obviously, as we've mentioned, you get one statement for all of your university choices, and if we see a lot of evidence that you've done something with a university that's maybe a rival and done a lot of interactions with them, we're probably going to think, well, actually, are they that committed to us as our first choice? So that is just something to just think about in your wording. But yeah, broadly, I think virtual experiences are great, and I think you should take them on board. But that being said, if you get physical opportunities as well, use both of them to enhance your statement. Next question, things like jewelry, makeup or shoes.
Yeah, I just think it's about being sensible. So I think you just got to be sensible about what you're wearing. And I think, you obviously wouldn't be wearing all the makeup that you would possibly wear on a night out, for example. We wouldn't expect to see that. So you just have to be sensible. So we wouldn't expect you to be dressed up like you were going on a night out. So as long as you're not got that much makeup on and not, big massive heels, then I would just say, just be sensible. When you look in the mirror, for boys and girls, men and women, anybody, just think, would my nan be happy with me walking into an interview like this? And then if the answer is yes, then just go for it.
And I'd also say on the shoes front, typically at our interviews, you do a tour of the simulation suite and things. And actually the parking, you might find there's not a parking space right next to the university door, and you might want to have a bit more of a walk around campus. So I would wear something that's functional, over flashy, if that's the right phrase, but just to sort of make sure that you can enjoy a tour. You're not going to get sore feet. Those sorts of things I think are really important as well. And it's, as we sort of said, it's all about being comfortable, I think. In terms of religious dress around interviews, I don't know if that's something you could just expand on as well.
Yeah, so religious dress, yes, you would be allowed wearing them. Of course, you would in interviews. So there's no restrictions on religious dress at all during interview or during placement. So when we think about, so I think the girls put an example in about Muslim wearing the coverings. During placement as well as nursing and midwives, you would be wearing them. So you would have your normal scrubs on, but you would also be wearing your religious dress as well. So please don't worry about that being a hindrance at all. You would wear an interview and you would be wearing it on placement as well.
Perfect. There's a few questions about virtual work experience, which we've kind of covered. I just want to just add that, going back to you, Michelle, because in that context, I don't think that would be okay purely, would it?
At the moment, because some of the practice out there is virtual, then virtual experience at the moment is still counting towards the experiential hours. Some of our students are on placements where that agency is delivering virtually, so it's a skill in itself as well, to be honest. So that is accepted.
The question about can you apply from Sri Lanka? You absolutely can. If you go onto the USW website and look at applications on the international page, they'll be able to give you guidance. I'll be honest, I've never handled personally an application from Sri Lanka as a UK-based recruitment officer, so I can't give you much specifics. However, things like the statement and process would be much the same. It would just be things like funding would be quite different. In terms of
Sorry, Ollie.
Yeah.
For nursing at the moment, so for nursing, we don't accept international applications for nursing.
In terms of outline for personal statements and how they should be set out, I would say broadly the first paragraph should kind of cover why you're interested in the course and why you'd be suitable. I'd then say you probably want 3 paragraphs around your skills and experience that relate to that course. And then the last paragraph I would kind of be almost like a conclusion or summary. So I'd normally say they should be about 5 paragraphs is quite typical, but that will obviously vary on the student. We might have some people on the call who have done much more work experience and are maybe coming from having worked in a healthcare background versus some people who might have a lot more using a lot of their skills they've gained through their schooling, but maybe less specific experience in that setting as well. Either's fine. It might be that that will vary some of the content that's in your statement, but that would be my broad structure. Is there anything additional or different you'd put from that, really?
No, I think that sounds like a really reasonable structure, yeah.
If you get grossed out and nauseous by stool, will it put you off activities like eating?
I love this question. I think it's a really good question. We often get people that, that get grossed out by things, and I work with people, and I have worked with people in the past. They get grossed out with things. It doesn't stop you doing your job, and it doesn't stop you doing daily activities. To be in the environment where you might have loads of stools or vomit or sputum or blood, you're so like concerned with the person that it's coming out with, and you've got so much compassion and care for that person that you don't generally get as grossed out as you think you might get grossed out by it. But generally, no, it's not going to put you off activities such as eating. You will end up eating a cake that looks like poo eventually. And you've got to remember that, when you come into this profession, most of us are not used to seeing large volumes of blood. Most of us are not used to seeing vomit on a daily basis. Most of us aren't used to seeing human bodies cut up, and seeing inside of organs. These things you will get used to, and you will get sensitized to a certain degree. So it is something that you will see, but you will get used to it, and it won't gross you out as much as you think it will. Honestly, it won't.
The question again about UCAT tests and things like that. I think you need to be looking at universities that do medicine. We don't, in terms of the medical sciences test, wouldn't do a UCAT score. We would interview for that course on top of your statement as an application. There's quite a lot of guidance if you went onto different university pages about how to apply specifically for those courses. I would say, if off the back of today, if you're particularly interested in things like nursing, social work, but certainly the other health professions as well, I know nursing pages are very established on this. They'll have how to apply specifically statements towards nursing and midwifery, which can be really useful. There are a few differences from, as I always get told, my history degree and what my application looked like in that sense. There is a little bit more of a masterclass in that sense as well.
Ollie, if we make these the last couple of questions, just because I know we're overrun a little bit and people want to get on with their evening, so feel free to take the last two.
So I think there's a really good question there about occupational health clearance. Do you want me to take that, Ollie?
Yeah, we'll finish on that one.
So we often get asked, is there a list of medical conditions, or is there a list of mental health conditions, or in fact a list of offences with the police that you cannot get into nursing for? So you do need occupational health clearance, and we do not have a list of physical or mental health illnesses that you cannot do the course with. It's about how you manage your disease process, how you manage your mental health on a daily basis will determine whether you're suitable for the course. Anything that's well maintained, you can do this course. So as long as you've got, we get asked about diabetes quite a lot. So as long as your diabetes is well controlled and you know how to manage it, then why would nursing be a problem? If your mental health is under control and you are happy and you are healthy, then why would this course cause you any additional stress? We've got to remember that any degree is stressful, so it's how you manage that stress and how you manage that stress with your medical condition. And if you feel that it's not going to impede you in the course, then it's not going to affect your occupational health clearance. It's about how you manage your condition and how that may be affected by the stress of the course or by doing things like 12-hour shifts or night shifts, for example.
Great. So Ollie, Pamela, Michelle, thank you very much for all the information you provided. Hopefully it's been useful to our audience and it will help them with their journey on, on a degree in healthcare. Thank you very much, everyone, for joining us and staying the duration. It's getting a little bit late, so we will send you a link to the recording and see you on the next webinar. Thank you very much, guys.
Thank you all. Best of luck with your application.
Thank you. Hopefully see you.
Bye-bye.